not in your periods? In this video today we are answering this question. So when you are a woman and you are experiencing lower abdominal pain, this could be an indication that there's something not right, because one thing we have to understand is that lower abdominal pain is brought about by many things happening to your reproductive system. When we take a look at the reproductive system, we have two ovaries here, and then we have the fallopian tubes. We also have this rounded structure. This is your uterus. The uterus is divided into three layers. That is the outer layer, also known as the perimetrium, the inner layer known as the myometrium, and then the innermost layer known as the endometrium. If you are experiencing lower abdominal pain and you are a woman, probably you are from 10 years up to maybe 40 years, this could be an indication that there's something wrong with your reproductive system. What you need to find out, or what you need to do, is go ahead and talk to your doctor. Your doctor will do some examinations on you. Your doctor will do some tests on you. And the test which will be done, the first test which I recommend to all my clients, all my friends, is that you need to do what we call a pelvic ultrasound scan. Pelvic ultrasound scan is a test, or it is an examination which is done in hospital where images are taken of your reproductive system. As you can see here, the ultrasound scan will show how your ovaries are, whether they have some swellings, also known as small cysts. Remember, we have talked about swellings or cysts on your ovaries in one of our previous videos. If you missed this video, please kindly go back and watch this video. After watching this one, you go through our videos on this very channel. We've talked about a condition known as polycystic ovarian syndrome, and we have said that this is a condition whereby your ovaries have small swellings, and these swellings actually tend to interfere with your chances of getting pregnant. We are talking about the causes of lower abdominal pain, and we are saying that it could be an issue with your ovaries. You could be having this condition known as polycystic ovarian syndrome, or you could be having ovarian cysts. Polycystic means you are having small swellings which are more than 9. If you actually do the scan and your doctor tells you that you have small swellings which are more than 9, then we call that polycystic ovarian syndrome. But remember, polycystic ovarian syndrome is a hormonal problem. It is a problem brought about by your hormones not balancing, and then at the same time it's brought about by many changes happening in your body. Lower abdominal pain can also be brought about by free fluid in your fallopian tubes. We say that these two are your fallopian tubes, assuming that you have two fallopian tubes, because we have some of our friends who have only one fallopian tube and one was removed through surgery. So no matter the number of fallopian tubes you have, whether you have 2 or 1 fallopian tube, if you are feeling pain and this pain is localized on either your right side or your left side, there could be an issue with your fallopian tubes. You could be having a condition known as hydrosalpingitis, or you could be having adhesions or tissues in your fallopian tubes. How can you confirm that you could be having either hydrosalpingitis? Hydrosalpingitis means free fluid in your fallopian tubes. When you get a urine tract infection, you do not treat it very well, or you do self-medication. You go to hospital, take some 2 tablets, and then you think you've got better or you've healed. What happens is that this infection can ascend because your bladder is just beneath your uterus. It's actually anteroposterior. It is just next to your uterus. This infection can pass through the small tubes leading to your bladder, also known as the urethra, and then this infection can go upwards up to your womb. When it moves up to your womb, it causes a condition known as endometritis. Endometritis is when you have free fluid in your womb. How can you confirm that you have endometritis? You are having low abdominal pain, and at the same time this pain is being brought about by endometritis. How can you confirm? It is very simple. You just simply go and then do an ultrasound scan. Specifically, you do what we call a pelvic or gynecologic ultrasound scan, and your doctor will be able to explain all the findings for you. We remember we've said that we are talking about the causes of lower abdominal pain. We've said that it could be an issue with your ovaries, it could be an issue with your fallopian tubes, and we have said that in your fallopian tubes there could be changes. Next, we've said that it could be an issue with your endometritis, or it could be an issue with your womb. Remember, in your womb, you could also be having masses or swellings. Actually, you could be having masses in your womb and you're feeling low abdominal pain, you are trying to get pregnant, you're not getting pregnant, you are actually experiencing your abdomen increasing, and maybe your friends are telling you that you are pregnant, but you do the pregnancy test, it is negative. What is the cause of this? This could be due to masses. And remember, masses are named according to their location. We have those masses which are inside, the fibroids which can be inside, and those are called the submucosal fibroids. Sorry about that. Submucosal is S-U-B. This is the spelling. So the fibroids can be inside. When they are inside your womb, we call that submucosal fibroids. And then they could be in between your layers of the myometrium. And specifically, when they are inside, remember we've said that when they are inside, we call them submucosal fibroids. And then we also have the subserosal fibroids. They could be actually subserosal, meaning that they could be located in between your layers or your myometrium. They could also be pendiculated. Pendiculated means it comes out of your womb, or the fibroid increases and then it grows outside your womb. It gets attached, just like you can have a branch being attached on a big tree. So specifically, when this fibroid is attached onto your womb and then it is growing inside your abdominal layer, then still it can cause pain, and the only way to confirm is by doing a pelvic ultrasound scan. Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend, on our channel. If it's your first time here, we talk about fertility. It is a fertility-based channel whereby we address issues preventing you from getting pregnant. I know that when you watch our videos, you'll get one video having that tip you've been waiting for, you've been looking for. So remember, you can get pregnant, but the key is you need to identify what could be preventing you from getting pregnant. We are proceeding with the causes of low abdominal pain. We've talked about the ovaries, we've talked about the fallopian tubes, we've talked about your womb, either having free fluid, also known as endometritis, or masses growing inside your womb, also known as fibroids. The pain could be due to fibroids. You could be having lower abdominal pain when you go to urinate. Well, actually, when you go to urinate, sorry about that. So when you experience burning pain, or when you experience pain when you are urinating, then you could be having a condition known as cervicitis. Cervicitis is a term, it's a name, it comes from the word cervix, whereby your cervix can be affected by the free fluid or by the UTI, which started off from your bladder and then it moved upwards. So as it is moving, ideally, when a woman is not pregnant, what happens is that the cervix is always closed. It only opens during ovulation, that is on the 14th day. When you are about to get pregnant, it opens to allow the male sperms to go through. Immediately fertilization takes place, it closes again. So ideally, your cervix is supposed to be closed. So if it actually gets affected by an infection which is moving upwards, it can swell, it can enlarge, and then it can be very painful. When you are experiencing this, you need to go to hospital and your doctor will request for some tests. Still, a pelvic ultrasound scan will be requested because it is a standard for all women. I always tell this to all women, all my clients. I tell them, before you do any other tests, it is very imperative that you begin with the pelvic ultrasound scan. When a pelvic ultrasound scan is done, it can show images of your cervix. Measurement of the length of your cervix will be taken, and then also your cervix will be actually visualized. Your doctor will be able to see your cervix, whether it is having some free fluid in between. Because when we take an example of maybe this being your cervix with a small canal in the middle, you realize that when free fluid, basically when a UTI enters into your cervix, it is going to cause accumulation of free fluid inside your cervix, because the cervix has two parts. It has the internal part and then it has the external part. So when the ultrasound scan is done and you are having cervicitis, the scan will show that there is some dark liquid. In the language of scan, in scan language, we call it, you could do, actually, there will be anechoic free fluid. You'll see that on your report. Your doctor will make a report and then say there's anechoic free fluid noted in the intercavitary space. Specifically, in simple terms, your doctor will confirm to you that you have liquid, you have free fluid which is collecting around your cervix. And of course, also you'll be noticing that there's that discharge which is not good coming out of you. There's a very bad smell coming out. And then of course, when you try to get pregnant, normally it becomes difficult. Even if fertilization takes place and you get pregnant, there are high chances of the pregnancy ending up as a miscarriage. Remember, we have said that among the leading causes of miscarriages, normally UTIs which are moving to upwards in your womb are among the leading causes. There are other causes like stress, like working a lot, carrying heavy things, and then of course not having enough bed rest, and then of course even taking some drugs. These can cause miscarriages, but among the leading causes, urine tract infections are among the leading causes. We've been talking about the causes of lower abdominal pain. This is the Fertility Show with Gerald Massa. On this channel, we do talk about pregnancy. We talk about the tips on how you can get pregnant faster. If it's your first time on our channel, I welcome you, and remember to go to our website. It is www.geraldmassathehealtheducator.com. That's www.geraldmassathehealtheducator.com. Come check out our website. We are doing lots of work in the community. We need your support. Support us by donating to our channel. Support us by donating on our website so that we can reach pregnant mothers with free ultrasound scans in the community. Your donation means a lot because we shall use it specifically to get the equipment for us, to enable us actually to get the equipment like ultrasound scans so that we can go to the community and then offer free ultrasound scans to our pregnant mothers, those hard to reach mothers who are in villages, so that we can reduce the number of mothers dying as a result of giving birth, dying as a result of complications arising from not having an ultrasound scan done. So with your support, I believe we shall reach all these mothers. Just go to our website. Any amount is welcome. You can donate anything, even $1 is welcome. Gerald Massa, the Health Educator, from geraldmassathehealtheducator.com is our channel. I welcome you. Remember to come back tomorrow for another video. I will be uploading more videos. We upload videos every day at exactly 8 a.m. and also at exactly 17 hours. That is at exactly 800 hours, and then also at 17 hours in the evening, we do upload videos about fertility. Remember, I can also talk about your question. If you have any question you would like me to do a video about, please just leave it down below in the comments. I will do a video on it. I will answer all your questions, and at the end of the day, we are praying for you that you also do get pregnant. Remember to put God first. We can give you this information we learn, they taught us, but you need to put God first in everything. Have yourself a fantastic and healthy day. Bye-bye. Bye-bye. Like to check if at all you are fertile or you are not fertile. The tests for fertility. What investigations can be done to determine fertility? Gerald Massa, the Health Educator, is the name of the channel. I welcome you for today's lesson, and we are talking about the tests you can do to check your fertility. So, without further ado, we are talking about the tests you can do to check your fertility. We have said that when you would like to know whether you are fertile or you are not fertile, there are some special tests which need to be done. The tests we are talking about here, both are radiological and they are serological. When I talk about radiological tests and serological tests, specifically we are talking about testing for fertility, whereby X-rays or scans can be done on your system. And stay with me, we are going to talk about the specific blood tests, the specific X-ray tests which will be done on you. So If you would like to know whether you are fertile or you are not fertile, the first very important test that will be done on you is to do what we call a fertility hormonal screen test. The first test for fertility is what we call the fertility hormonal screen test. When we talk about the fertility hormonal screen test, this is a test which is done to check or to assess your hormones to see whether they are within the normal ranges or they are not within the normal ranges. If you are a couple, you have tried to get pregnant and things are not working out, it is high time you do a test. You check your hormones to see how they are, whether they are within the normal ranges or they are not within the normal ranges. And the first test or the first hormone we shall look at is what we call progesterone. When you would like to know whether you are fertile or you are not fertile, it is very important to know the levels of a hormone known as progesterone. We shall talk more about progesterone later on as we proceed, and the next hormone is what we call LH or luteinizing hormone. And then the next hormone is what we call the follicle stimulating hormone. Next hormone is known as the E2 or the estradiol. E2 or estrogen is a hormone which is actually produced by your egg cells. What happens is that in your brain there's a part known as the hypothalamus. There's a part in the brain known as the hypothalamus. The hypothalamus tells the anterior pituitary gland, abbreviated as an APG. It is the hypothalamus, a part in your brain which tells or which stimulates the anterior pituitary gland to produce the two hormones. The first hormone is known as the FSH, and then the next hormone is known as LH. So the anterior pituitary gland the hypothalamus stimulates your anterior pituitary gland, and then the anterior pituitary gland will produce two hormones. The first hormone is known as FSH. FSH in full, it means the follicle stimulating hormone, or it is the hormone which stimulates your eggs so that they grow. Just like you can put a seed in soil, when you just as you can plant a seed in soil and then you water it, you apply manure, you do everything to make sure that the seed grows. Specifically, what is responsible, or the hormone which is responsible for this function, is what we call the follicle stimulating hormone. So if you would like to know why you are not getting pregnant, why you are having issues getting pregnant, you've taken all the drugs and things are not working out, it is high time you discuss with your doctor about testing for hormones. Because what happens is that you cannot just show signs, you cannot sit there and see that maybe this hormone is not balancing. What you need to do is you need to do a blood test to check for these hormones. And when we are to explain something here, very brief, you realize that when these two hormones have been produced, that is FSH plus LH, when they have been produced, they are going to travel to your gonads, or they are going to travel to your ovaries. And when FSH and LH reaches your ovaries, assuming this is an egg cell, or assuming the ovaries have produced an egg, there's going to be changes which are going to take place. We said that FSH and LH are produced in the brain. When they travel through the blood up to your ovaries, they are going to act specifically on an egg, or they are going to act on your egg. So when FSH and LH act on your egg, the end result is going to be that two hormones are going to be produced. The first hormone is known as progesterone. And then the next hormone is known as estrogen, or abbreviated as E2. So when FSH, that is when the follicle stimulating hormone, acts on your egg, there's going to be release of estrogen. FSH brings about the release of estrogen, whereas LOH, known as luteinizing hormone, acts on your egg and then it brings about the release of progesterone. Now, estrogen is very important because it plays very many roles. It prepares your womb, it prepares your uterus, it brings about the thickening of your uterus so that when implantation happens, implantation becomes successful. So that when the egg attaches onto your womb, there's going to be growth which will take place. When you have low estrogen or when you have a dysfunction in the levels of estrogen being produced in your body, there's going to be pregnancy difficulties. You could actually end up with infertility. And then when progesterone has been released, this is normally in the luteal phase of your menstrual cycle. That is, immediately after ovulation has taken place, progesterone is going to surge. It's going to increase in its levels. And if at all this is your womb, if this is your inside of your womb, progesterone being released in your uterus is going to make sure, or it's going to make sure that when the egg has attached onto your womb, the egg grows into, actually the fertilized embryo grows up to that formation. It grows into a successful pregnancy, in simple terms. So what brings about a successful pregnancy in your body, if at all you have undergone fertilization, is this hormone known as progesterone. Progesterone is a pregnancy-friendly hormone. It makes sure that your pregnancy goes on to become successful. If you have insufficient progesterone hormone, then there's going to be repeated, or there's going to be miscarriages which will be repeated. Miscarriages mean, or to have a miscarriage, it means basically you are not able to carry a successful pregnancy beyond 20 weeks. So if you have tried to get pregnant, you are a couple, you've taken all the drugs, you've taken Clomid, you've taken letrozole, you've taken all the fertility drugs, but things are not working out, you have an issue of unexplained infertility, then it is high time you do a fertility hormonal screen test. And after doing the fertility hormonal screen test, your doctor or your specialist will be able to interpret for you your results and then, of course, give you the best remedies, the best treatments, the best thing on the results of your hormones. You can also have a private chat with me on my channel www.geraldmassa.thehealtheducator.com, and we shall share more about how you can get pregnant faster naturally. We talked about the other tests of fertility, or to check whether you are fertile or you are not fertile, and we said that the next test is an X-ray test known as the HSG, and we said that the HSG test specifically, it means the hysterosalpingogram. HSG means hysterosalpingogram. The hysterosalpingogram test is a test whereby they will check for your fertility. They will get a chemical or a dye, a contrast media, which will be introduced into your private part, your V, and then this chemical goes upwards into your womb and into your fallopian tubes, and then when it reaches your fallopian tubes, where there's a blockage either due to free fluid or adhesions, then it will collect there. Results or pictures will be taken, and then where this contrast media or where this chemical has accumulated, that is the point of blockage, and then the report will show where the blockage is. Your doctor will, based on that, to give you the best care, whereby they may do tubal unblocking in the theater by doing a simple procedure also known as a laparoscopic operation. So we are proceeding with our tests, and we have said that we've talked about the blood tests, whereby we said that your hormones can be checked in your blood. We also said that X-ray tests like the HSG scan can be done. There's also another special test known as the hysterosalpingogram. It's also very important. And then the next test which will be done to assess your fertility is what we call the pelvic ultrasound scan, whereby more attention will be given to your ovaries to your ovaries to see what could be happening with your ovaries. When we do this pelvic ultrasound scan, if at all this is your ovary, there's going to be follicles which will be seen. Follicles are those shells where the eggs are kept. So ideally, you are supposed to be having a dominant follicle, which is also known as the Graafian follicle. That is, when you do this pelvic ultrasound scan on the 14th day or when you are ovulating, you'll be able to see a dominant follicle which is actually getting ready to rupture, which is actually getting ready to undergo ovulation. If you do the pelvic ultrasound scan on your 14th day, that is on the day when you are ovulating, or the day, actually you can do it on the 13th day. When you do it on the 13th day or even the 14th day, and basically we are supposed to be seeing a dominant follicle, and your scan shows that there's no dominant follicle, you do not have actually an egg which is going to undergo ovulation, then it means you could be having issues with ovulation. And that's when we need to correlate the results of the pelvic ultrasound scan test or the pelvic ultrasound scan with your progesterone levels. Remember, progesterone increase means that implantation is actually taking place, or it has taken place. Gerald Massa, the Health Educator are my names. Remember to subscribe to our channel. If it's your first time on our channel, I welcome you, my friend. You are most welcome on our channel. Watch all our videos. I believe you'll get a video which will give you the tip you've been looking for in regards to fertility. Hello, my friend. We are talking about a missed period with a negative pregnancy test. Have you missed your periods? Have you done the pregnancy test and the pregnancy test is showing you that it is still negative? You are asking yourself what could be happening to you. A missed period with a negative pregnancy test. I welcome you to our channel, Gerald Massa, the Health Educator, and on this channel we do create fertility and reproductive health awareness. Welcome to our channel, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. Today we are talking about a missed period with a negative pregnancy test. We are looking at what could be causing you to see a negative pregnancy test and yet you have missed your periods. The first thing we need to take into consideration is that for you to see your periods normally and regularly, you should be having a healthy reproductive system, and then also you should be ovulating. You should be ovulating very well. By ovulation, I mean you should be able to release a mature egg on the 14th day. But what if you have undergone ovulation, you are actually seeing all the signs of ovulation, and then you are expecting to see your periods in the next 2 weeks, but you do not see your periods. Probably you go ahead and miss your periods for even 2 to 3 months. What could be happening? So when you are seeing a missed period with a negative pregnancy test, the commonest thing we need to take into consideration is, are you taking any family planning medications, or are you taking any medications? The causes of a missed period with a negative pregnancy test could be that you could be taking some medications. For example, if you are taking family planning drugs, if you are taking family planning medications, this could be pills, there could be the IUD which is inserted into your womb, and then it could actually even be a family planning method, like maybe a no plant or an implant attached or inserted into the posterior part of your arm. So these family planning methods bring about a missed period. If you are not seeing your periods and you are on family planning, then it could be a direct effect of the medication you are taking. A missed period could be a direct effect of the family planning medication you are on. Also, if you are missing your periods and you are not actually pregnant, you do the pregnancy test and the test is negative, this could be due to stress. A woman who is stressed mostly will end up having missed periods. They may actually not be able to see their periods. So I welcome you to our channel, Gerald Massa, the health educator, and on this channel we do talk about women's health, we talk about fertility, we create awareness about fertility and reproductive health. So when you are not seeing your periods and you do the pregnancy test and it is negative, it could be due to stress, as we've just said. It could be that you are taking some family planning medications, or you could be taking other drugs which could be interfering with your hormones. The other main reason of you not seeing your periods is that probably you could be pregnant, but maybe you have tested very early. Very early testing, for example, you miss your periods after 1 week, you go and do the test. You could actually do the test with the urine pregnancy tests, which were actually maybe expired or they were stored badly. And then when you do the test and it shows you negative and you missed your periods, it could be that maybe you tested very early. The other point, the other reason for a missed period is that you could actually be having an issue or a case of irregular periods. You could miss your periods and yet already you are experiencing irregular periods, which could be brought about by some conditions. These conditions include polycystic ovarian disease, where your ovaries have lots of small growths or small cysts. Let me answer all your questions and I will be able to answer all the questions you ask me. Please ask your questions down below the comments of this video and I will answer all your questions. Gerald Massa, the health educator, is the name of the channel, and today we have talked about missed periods. Why are you not seeing your periods and yet you are not pregnant? And we have said that there are many causes of you missing your periods. The first cause is it could be that you are stressed. You could be on family planning medications, you could be having irregular periods, or you could be having disease of the womb. For example, if you have polycystic ovarian disease, then there are high chances that you may miss your periods for many cycles, or you could have an issue of irregular periods. I'm really so happy that you have watched our video, and remember, we are proceeding with our lesson.
How to calculate your ovulation cycle, how to calculate your ovulation calendar, how to calculate your ovulation calendar, how to track your safe days and your danger days using the calendar method. Assuming you are seeing your periods on the first day, which is around this period on Monday, assuming your first day of your period is on first, which is Monday, and then you see your periods again on second, you see your periods again on third, that is Wednesday, and then also you see your periods on fourth. We want to use this method to identify the days you are going to ovulate. Remember, we've said that when you see your periods on day 1, that is on Monday, day 2, that is Tuesday, day 3, that is Wednesday, and day 4, that is Thursday. Just we are using this as an example, but it could be actually any other day of the week, but we are using this as an example. So in this particular case, you see your periods for 4 days, that is 1, 2, 3, 4. You started on first, which was Monday, and then you finished on Thursday, which is actually the 4th of Thursday. You want to know your ovulation days, the days you are most likely to get pregnant. We are supposed to do the counting. First of all, we shall understand what an ovulation cycle is. An ovulation cycle, or the ovulation day, the days of ovulation, are those days when a mature Graafian follicle or a mature egg is released, and the chances of getting pregnant are very high. So you saw your periods from first, second, third, and fourth. What we are supposed to do is to count the days from the first day of seeing the periods to the first day of the next period. assuming your next period is going to be around maybe 26th, 27th, 28th, okay, and maybe 24th when you are getting off your periods. Assuming your next period is from 26th, 27th, 28th, and 29th. If you want to identify the days of ovulation, the days you are most likely to get pregnant, you are supposed to count from the first day when you saw your periods, count 14 days. And on the 14th day, add 3 days in front and add 3 days backwards. We are saying that to calculate your ovulation days, you count the first day when you saw your periods and you count 14 days. On the 14th day, add 3 days, subtract 3 days, and specifically those are the days you are most likely to get pregnant. We shall go and do it practically. Assuming you saw your periods here, this is the first day you saw your periods, that is Monday 1st. So we are going to count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So according to this cycle, the 14th day is specifically here, and that is on Sunday. But according to our method, we said that when the egg has been released or when ovulation is taking place at this 14th day is the peak period when you are most likely to get pregnant. We add 3 days in front. We say 1, 2, 3. Come back on the 14th day and we also add 3 days backwards and say 1, 2, 3. So the days you are most likely to get pregnant or the days of ovulation are from 11th, 12th, 13th, 14th, 15th, 16th, and 17th. Specifically 3 plus 3 you get 6, plus the 14th day which is 1 you get 7. So it's always that week. It's always 1 week. To get this, we shall go backwards. We shall repeat this again for our friends who have not picked it. We said that to understand the days you are most likely to get pregnant, we start from the first day when you saw your periods. Assuming you saw your periods around here, the first day of seeing your periods, count from the first day when you saw your periods, count 14 days and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And we've said that the 14th day is the day you are ovulating, but this process goes on for the next 3 days, and it also starts the first 3 days before you saw your 14th day. So you add 3 days in front, add 3 days backwards, and specifically from this period up to this period, those are your unsafe days or your days of ovulation. If you do not get pregnant in around here, then the egg goes into what we call a corpus. It becomes what we call a corpus luteum or a corpus luteal phase. The next 2 weeks are basically the egg which was supposed to become fertilized. The egg which was supposed to be fertilized, if it is not fertilized, the remaining follicle becomes what we call a corpus luteum. We shall talk about that in our next video, but in today's lecture, as I'm summarizing, we have been talking about how to calculate your ovulation cycle, how to calculate your ovulation days, how to track your safe days and your danger days using the calendar method. And we've said that simply to understand your menstrual cycle, you have to count from the first day when you saw your periods to the next day when you will see the next period. Thanks a lot for staying with me. Gerald Massa, the Health Educator, is the name of the channel. Have yourself a fantastic and healthy day. Remember to subscribe for new videos every day about women health. Bye-bye.
Hello, welcome. Why you have been told that you are not getting pregnant? Have you ever asked yourself why you are not getting pregnant? You have taken all the drugs, you have followed all the diet plans, but still you are not getting pregnant? This is Gerald Massa from geraldmassa.thehealtheducator.com, and on this channel we do create awareness about fertility and reproductive health. we are going to answer a question that has been asked by one of our viewers, and this question is this: I had a miscarriage, will I get pregnant again? One of our viewers had a miscarriage and she's asking, will she be able to get pregnant again? Watch this video up to the end and we are going to answer this question together. This is Gerald Massa, the Health Educator, and I welcome you on our channel. Remember to subscribe for new videos about fertility, about reproductive health. We release every day at 17 hours. So, she's saying that she had a miscarriage. Will she be able to get pregnant again? One thing we should take from this question is that there's this word called a miscarriage. A miscarriage is early pregnancy loss. When a woman is pregnant and before the pregnancy makes 20 weeks, the pregnancy comes out, we call that a miscarriage. There are many types of miscarriages or abortions, and specifically, we shall not go into all the details, but in brief, we have one which is inevitable. An inevitable miscarriage happens whether you've done anything, whether you've taken any drugs or you've not taken any drugs, or it just happens. And then there's that whereby it is incomplete, and then there's another type which is actually complete, and then of course there are other types which are actually known as molar miscarriages. So we are talking about a miscarriage. We are answering this question by one of our subscribers who said that she had a miscarriage and she would like to know, will she be able to get pregnant again? When you look at this question, you realize that at first she was pregnant and then she had a miscarriage. Just by the mere fact that she got pregnant, this means that she can still get pregnant again. The most important thing we need to do here is that she needs to do what we call a pelvic ultrasound scan. She needs to do some tests and then identify what caused the miscarriage. And then after identifying what could have caused the miscarriage, she can still go ahead and get pregnant again. So we are answering a question by one of our subscribers, and she said she had a miscarriage. The question is, will she be able to get pregnant again? The answer is address or handle what caused the miscarriage, and then you will be able to get pregnant again. There are many causes of miscarriages. The commonest causes are infections, for example, a PID, when a woman gets an infection and then she does not treat it very well, specifically a urine tract infection, and then she treats it poorly or she does not get treatment. There are high chances that this infection can ascend upwards up to your cervix, and then it may cause what we call cervical incompetence, or your cervix may actually open up and you can end up into a pregnancy loss. So to answer a question asked by one of our subscribers, it is very, very possible that you can get pregnant again, but use that time after they've done the cleaning of your womb. Use that time to find out more about what could have caused the miscarriage. So we are proceeding with our answer for this question, and we have said that the commonest causes of miscarriages include infections. They do also include stress, and then of course also overactivity. If you are pregnant and you are working a lot, you are sitting for, actually you are doing lots of activities, you are carrying heavy things, you are moving from place to place, and you are pregnant, you are still actually in the early stages of pregnancy, you are in the first trimester, but you are moving a lot. Overactivity can bring about pregnancy loss. So if you are pregnant and you are in your first months, it is very advisable that you do the routine checkups so that actually if at all an infection is identified in your urine, it will be treated by your doctor. And then also if you are undergoing lots of stress, it is very important to deal with the stress, because one thing that is true is that you cannot run away from your stressors, but you can look for ways of either avoiding the stressor, adjusting to the stressor, or even altering the stressor. Because when you are pregnant and you are exposed to constant